So I think for a long time in this country, we've known that there's a great disparity between minority populations and the majority population in terms of disease burden. And depending on where you live, your zip code has more to do with your health than almost anything else.
But there are a lot of smaller safety net facilities, as well as small academic medical colleges within the United States. And those in those smaller environments don't have the access, to the technologies that the larger ones have. And, I call that digital disparity.
So Meharry is an academic health sciences center, and our mission is to train diverse healthcare providers and researchers, but also provide services to underserved populations. It's part of the reason why I think it's so important for Meharry Medical College to do data science.
One of the things that both Cloudera and Clearsense are very passionate about is bringing those high-end technologies to those smaller organizations. It's very expensive to go to the cloud for these small organizations. So now with the partnership with Cloudera and Clearsense, Clearsense clients now enjoy those same technologies and really honestly have a technological advantage over some of the larger organizations. The reason being is they can move fast.
So we were able to do this on our own without having to hire data scientists. We probably cut 3 to 5 years off of our studies.
I grew up in a small town in Arkansas, and it's one of those towns where the railroad tracks divided the blacks and the whites. My father died without getting much health care at all, and as an 11-year-old, I did not understand why my father could not get medical attention because he was very sick.
A lot of students who come at Meharry are looking to serve populations that reflect themselves or reflect the population they came from. A lot of the data you find or research you find about health is usually based on white men, and obviously not everybody who needs a medical provider is going to be a white male.
One of the things that we're concerned about in healthcare is that there's bias in treatment already. We want to make sure those same biases do not enter into the algorithms.
But the issue is how do we get ahead of them to try to prevent these disparities?
One of the great things about our data set is that it contains a very diverse group of patients.
Instead of just saying everyone will have these results, you can break it down by race, class, cholesterol level, other kind of factors that play a role so you can make the treatments in the long run more specific.
Researchers are now able to use these technologies and really take those hypotheses from benchside to bedside.
So that we're able to overall improve the health of not just the person in front of you, but the population that you're serving.
Yeah, well, the future is now. I love a quote by William Gibson who said, "The future is already here, it's just not evenly distributed."
If we think hard enough and we apply things properly, we can, again, take these technologies to underserved environments in healthcare. Nobody should be technologically disadvantaged.